Section of the Chef Coaching Program. I'm Mariah Petchel. I'm a board certified health and wellness coach, and I'm the marketing coordinator for Chef Coaching. Joining us is also Jane Barg. She's also a certified coach as well as program faculty and chef. And we also have Shirley Garrett joining us as well, and she is also on our faculty and teaches a lot of our cooking courses. So just for the outline, just to go over kind of what we'll discuss tonight, what is the Chef Coaching Program? Why was it developed? And how has it evolved, including why it's so relevant today in the field of lifestyle medicine? We'll go over key principles of the program. We'll review the program structure and how the training is used in practice. We'll discuss upcoming cohort times and registration. And then at the end, we'll have a Q&A for any questions that you may have. So what is the Chef Coaching Program, and how and why did the program begin? In 2014, our director, Dr. Ronnie Pollack, founded Clinicians CHEF Coaching. At the time, research was showing that increased cooking in the home with basic culinary skills could improve nutrition and overall health. Further research showed barriers with increasing cooking in the home, and that is why health coaching techniques combined with the teaching of culinary skills proved to be the best way to increase home cooking habits. And this is why the chef in chef coaching actually stands for Culinary Health Education Fundamentals. So what is a major problem with our health today, and why is this kind of program really so vital in the current healthcare system? Well, in the US, the most important risk factor for quality of life and longevity is an unhealthy diet, which is associated with 26% of deaths and 14% of disability-adjusted life years. In the past few years, we have found out that obesity is the #2 risk factor for COVID-19 related morbidity and mortality after chronological age. And we know that unhealthy diets are a risk factor for obesity. So this is very timely and extremely important, as evidenced by the pandemic. It's something motivational, though, about unhealthy diets in that they're not inevitable. It's something we can address and we can have an impact on. There are many risk factors for chronic disease and low quality of life, and this is just one that we have many tools to actually change, especially as healthcare educators of our communities. When we look over the past 40 years, research has shown that home food preparation has decreased by 23%. And at that same time, there are a 32% increase in prepared processed, ultra-processed, or fast food being brought into the home. So over time, with increased processed food consumption and less home-cooked meals, we are seeing an overall rise in chronic disease. So the Chef Coaching Program was founded, Culinary Health Education Fundamentals, and it was formed to train individuals to combat these issues. It's an innovative program designed to provide easy-to-follow culinary interventions to improve nutrition through home cooking. We address the decline in home cooking and hopefully lead to less consumption of ultra-processed meals overall. The program has two arms: a research arm, which studies the best ways to improve nutrition through home cooking, and we also evaluate the benefits of the program, which we'll discuss in a few minutes. And then we have the education arm, which is how we deliver the curriculum so that it can be implemented in real-world settings. There are three key principles to the program training. The first one is to focus on proven barriers to home cooking using behavioral change techniques, being both a coach and a trainer. And what we found is that these two hats together support sustained behavior change. This was summed up in 2017 in the Applied Psychology, Nutrition, and Metabolism Journal, with a definition of culinary coaching being published and defined as behavioral intervention that aims to improve nutrition by facilitating home cooking through an active learning process for participants, combining culinary training with health and wellness coaching competencies. Key principle 2 is that we are using a telemedicine approach, which reaches a broader audience and provides culinary training without having to utilize a professional kitchen. It also works with people in their own home, meeting them where they are, and hopefully either further facilitating their ability to increase home cooking. They're using their own appliances, their own space, and it can really be custom tailored to their own needs. Our third key principle is that we are a plant-forward program, and any diet can benefit from increased plant intake, so you can really work with anyone's dietary needs with this training. This can be summed up in a quote from Michael Pollan, which you may be familiar with. It's eat food, not too much, mostly plants. And then to switch to the research arm of our coaching, there are a few research studies of which we're currently involved. The first is evaluating the impact of a culinary coaching telemedicine program on body weight and metabolic outcomes. And we'll talk about that in a few minutes. And the second is a pilot study just completed, which looks at the outcome of a telemedicine culinary coaching program on spinal cord injury patients that often do not have much mobility and end up with heart-related conditions due to their immobility. The third study is evaluating the impact of our program training on medical students and their ability to prescribe nutrition recommendations to patients. Going back to the first study, we have significant findings that culinary coaching leads to weight loss. These are the preliminary outcomes to the first study listed that we just talked about. At the 6-month mark, we noticed that the intervention group had lost 4.2% of their body weight, while the control group lost about 1%. One thing to really mention here is that the pandemic began in the middle of our research. So we also learned about the resiliency of this training during the pandemic. Significantly, this is at the 12-month mark where the intervention group maintained that weight loss during the pandemic and the control group gained 1.2% of their body weight back. Another point to mention is that when the FDA is evaluating the benefits of a weight loss medication, their benchmark is 5% loss of body weight. So these findings of nutrition and lifestyle intervention are right up there with weight loss medications. So what tools does culinary coaching use to be effective and increase cooking in the home? As mentioned before, we wear both a culinary training hat and a chef coaching hat. The culinary training hat is a teaching method to combat lack of culinary skill. Understanding of healthier ingredients, including options maybe people have never even considered, such as legumes to thicken soups instead of heavy cream, or using certain herbs and spices to flavor food instead of just salt. We look at healthier cooking skills, such as steaming or light roasting. We discuss organizational and time-saving techniques, which is particularly important for busy families and the individuals who don't think they have time to prepare healthier food at home. Then we also wear our health coaching hat, which addresses confidence and self-efficacy. Not only do people need to have the knowledge of how to cook, but they have to believe that they can implement these behavior changes and hopefully sustain them over time. So next, we'll kind of just go over a program overview and what this course looks like. The structure of the program and how it's delivered. It is a 2-part program with varying delivery methods depending on your profession and preferences. The first part is informational and skills-based and therefore can be delivered in a self-paced online format. Part 2 of the program is always offered live streamed in a small group setting where you take the basics training and put that into practice live with peers and faculty. The benefits of part 2 is really getting active learning and experiencing telemedicine in the mode in which we hope you will then be able to deliver the training. This is a certificate that you will receive should you complete both part 1 and part 2 of the program. And just to dive a little deeper on part 1, as mentioned before, we are addressing barriers to home cooking. We discuss healthy cooking techniques, skills to improve kitchen organization, and which may be setting up your mise en place or the kind of ingredients you usually keep on hand in the kitchen. We discuss decreasing cooking time, which may be batch cooking or one-pot meals. Then we dive into coaching tools, which are really the foundation of the training and a way to build confidence in an individual using skills such as open-ended questions, appreciative inquiry, utilizing your client or patient's strengths. You'll also receive recipes and curated materials, questionnaires, and things you can just use as a provider to really establish a foundation for implementing this training, both during the training and in the future. And then part 2 is beyond the basics. It's practice in the training. As I said before, they are 5 90-minute small group practice sessions with 10 participants each. These are the skills you develop and put into practice. Here you'll be able to practice the training with your peers as well as chef coaching faculty. You'll also experience what it feels like to be coached yourself. And hopefully these sessions also increase your confidence and your self-efficacy to implement the training. We've trained individuals in over 50 countries so far, and our hope is to even broaden that reach for culinary coaching in the future. So what are the culinary opportunities available to you during the training? Each week and beyond the basics, you will also receive recipes that you can try out at home and then come to class with any questions you may have. Week 3, as presented here, includes one cooking class where you will remotely cook with your group and program faculty, and you can ask us any questions that may arise with your own home cooking skills and techniques learned. This is also a telehealth delivery where we discuss the accessibility and expensive tools that you can use at home as a provider to teach people in their own kitchens, such as a live Zoom call and phone camera placement. And just to kind of test out what participants originally thought of the at-home cooking class, we conducted some of our own evidence-based data for cooking online. We had 64 clinicians participate from their own kitchen, and 70% rated the quality as very good or excellent, and 73% rated its relevance to clinical practice as good or excellent as well. So participants really do enjoy having this remote cooking class as part of their training. So who should attend? Over 50% of our attendees have been physicians, but really there's no limit to who can take the course and benefit from being part of the training. We have nurses, health coaches, chefs, physical therapists, just to name a few. The training is really inclusive of many professions who are maybe already part of or looking to get more training in the field of lifestyle medicine. And that really is something special about taking part 2, when many professions come together to interact with one another and practice the training in real world settings. There are 2 main professional implementation categories people usually envision when they start the course. They usually want to either become a culinary coach, or they want to adopt culinary coaching principles into their own established practice and profession. With implementing the training, there are potential ways that you can implement it and what you could hope to do when you have completed the program. You can improve your own home cooking, being an example for your patients or clients. You can add home cooking discussions to medical, nutritional, or coaching encounters. You can also include culinary coaching principles as part of office visits or culinary programs. And you can even develop your own remote culinary coaching programs. We've had a lot of graduates who have done this, and it has excelled. They are great pillars of their community. We have also had hundreds of lifestyle medicine programs that have included culinary coaching modules in their organizations. And one highlight is especially the VA in Boston, where the physician's assistant students have a whole health model that includes the chef coaching program. We've also expanded our reach with institutions, including medical schools and healthcare systems. Recently, these included instructing pre-med students through Queen's Medical School in Kingston, Ontario, as well as a program with Kalamazoo Community College, of which this is our second cohort, working with them, including medical students, physicians, educators, as well as chefs and other allied health practitioners. So next, let's talk about upcoming delivery options and how you can register for the course. Part 1 can be taken self-paced online through Harvard Medical School, either before or in tandem with Part 2. These are pre-recorded modules with continuing medical education credits available. The delivery options for part 2, we have an upcoming April cohort live streaming through Harvard Medical School. To reiterate, these consist of 5 small group practice sessions with 10 participants each, where you will work with faculty and peers to practice the training. We also have a July cohort delivered online through Harvard, which will be the last until winter 2025. We also have 2 other additional delivery options. One for the basics that is part of the Tools for Promoting Healthy Change conference, which is a 3-day conference, but you have to join the conference in order to participate. And another delivery option, which combines part 1 and 2, is delivered through Spalding Rehabilitation Hospital online. So if you're interested in either of those options, you can refer to our website below or email us directly with any questions. Since 2014, we've trained over 3,000 individuals in chef coaching, and we've provided the training to people in over 50 countries. And as mentioned, this is the certificate you will receive should you complete both parts of the program. This is our team. We have members in both research and education, including individuals at the Institute of Lifestyle Medicine, who are also part of making all of this happen. And if you'd like to stay connected on social media, you can find us at Chef Coaching with the following channels. We will be providing actually an updated Research Insights webinar where our founder, Dr. Pollack, will discuss the research being done with home cooking and culinary medicine. So follow us to hear about any of these upcoming offerings. And just to wrap up, this is a graduate spotlight from Dr. Teresa Stone. She's an advocate and a member of the College of Lifestyle Medicine and a chef coaching alum.
Thank you for welcoming me today. My name is Terry Stone. I'm an internist in Washington, D.C., and I'm a co-founder and creator of Fresh and Savory Culinary and Lifestyle Medicine program in D.C. Coming to the Clinicians CHEF program, CHEF Coaching program, we were able to not only just teach a cooking class and teach culinary skills, but also gave me skills to become a better doctor. I feel like the act of listening, motivational interviewing, helped me to be more present with my patients, helped me to be more aware and just address some of their obstacles in addition to celebrating their wins. We started with a small group of just 8 patients, and then now we have 20 patients in each cohort. So we have over 100 patients that have finished the program. So one of our greatest success stories is a man that was running marathons and eating healthy and kind of slumped into depression and gained over 150 pounds. He came to us in 2017 and he was referred by his cardiologist. In a little over a year, he's lost 105 pounds and he's doing fantastic. He is no longer taking any of his diabetes drugs. His hemoglobin A1C is 5.8 now, and he no longer has hypertension. He's well controlled just on lifestyle alone. I think the highlight for the program for me is that we realize that no patient wakes up and says, hey, I want to take a bunch of pills every morning. And I think what we do in this culinary chef program, coaching program, is that we build culinary confidence for ourselves and for our patients. We're better able to address our patients' obstacles to health. And then we become a team with our patients. I think that's the best thing from the program.
Okay, so